snoring is scary. But sometimes no snoring is not necessarily safe. Causes such as brain injury and nervous caused central sleep apnea syndrome, manifested as during sleep. The nasal and oral airflow in the thoracic and abdominal breathing. In layman's terms, which means the brain intermittently forgets to breathe. Some patients have obstructive and central sleep apnea, have both types. So how can we judge whether you have such a problem? Here is a simple scale, 1 point for each item. You can estimate your score based on this. If you score more than 3, it indicates the risk of OSOS. At this time, it is highly recommended that you go to the hospital for testing. Clinically, it is mainly through polysomnography. To make a diagnosis, simply put, you need to sleep in the hospital sleep monitoring room overnight, so that the doctor can check your various to be checked, including nasal airflow, chest and abdomen movement, ECG, and blood oxygen saturation. Among them, apnea-hypopnea index is the core indicator, which is the number of apnea and hypopnea per hour when high is greater than or equal to 5 per hour and accompanied by any of the following symptoms, or without the above symptoms, and AHI is 15 or more per hour. It can be diagnosed as obstructive sleep apnea. Sleep monitoring can not only be used for diagnosis, but also assess the severity of the patients, including sleep structure, oxygenation, and changes in electrocardiogram and blood oxygen. The disadvantage is that you need to stay in the hospital overnight. If you find it inconvenient and there is no condition for PSG monitoring nearby, the doctor may ask you to use a portable for initial screening. It can simultaneously record and analyze data and can be taken home. The disadvantage is that it is not as comprehensive as PSG. If you really don't have time to go to the hospital, at least use a smart bracelet or watch to monitor your blood oxygen. The oxygen level is 95 to 100%. If it's always below 90%, please go to the hospital if it is diagnosed as OSA. How can we improve and treat it?
I'm using a CPAP machine made by Taikangjian in China. This dual level CPAP machine. This one is the most cost-effective. Look, this small water tank is for water, which humidifies and heats the air in the pipeline, and heat, which can avoid symptoms such as dryness and bleeding. The noise is very low, or even negligible, because you can't hear it. After all, it's so enjoyable. The most important point is that through AI algorithms, let the machine adapt to your physical condition. The most important point. Now, contact Taikangjian's health consultant. You can get a new discount. What's up? At 8613-4238-02774.